Hello, and thank you for joining me on episode number 1 of the Animal Welfare Data Center podcast. My name is Anthony Robles. I'm the founder and CEO, and I'm really excited to be kicking off this brand new series where we're going to be talking about everything that the public can do to help the animal shelter crisis, what we're doing to try to help the animal shelter crisis, and overall what's really going on. And I think that's a really good place to start is what is the crisis? And who are we? So the Animal Welfare Data Center started back in 2022. My wife and I first started it to try to collect public shelter data and to conduct research on what happens inside of animal shelters, and trying to find some of that data online through all of the other avenues it's typically available proved to be very difficult. So we made it our mission to collect as much data as we can, do as much research as we could on legislation, policies, procedures, and historically what kind of problems we've seen in the past and what people did about it to try to help it. And after gathering all of this information, we aim to make all of that available to the public. So that way everyone all over the place could use the same tools, the same data, and the same steps to try and make an impact in their own communities the way that we're trying to make an impact in our community. And with that, we kind of fell upon this concept that applies to all of the shelters and all of the communities in the state. Because what we found was that many of the issues in these shelters are the same from city to city, from county to county, from state to state. So what is the animal shelter crisis? When we first started looking into it, we were trying to understand the same issues that we were hearing about from the community, but what those issues were was not so clear to us. So we ended up visiting some of the shelters in our local community. We started making public records requests to see the data from these shelters to try and identify what those issues are. In that research, we've come up with a handful of primary issues that are affecting everybody in the community. And if you're watching this feeling like I'm not involved with animal shelters, I don't work with animal shelters, I'm never at animal shelters, this doesn't impact me, we're going to talk about how this is affecting everybody in all communities, either financially, your health, or if you are involved with animals, understanding what's really going on in these processes, working with the municipal facilities. And something that we're going to talk about, probably not today, but in a future episode, is how a lot of these issues that we're seeing ends up making its way back into food and products that we all use every single day. And that in and of itself is enough to make anybody want to get informed and understand what's really happening in our shelters. Starting with the first issue, we're talking about overcrowding. Overcrowding is absolutely by far the biggest issue right now in the animal shelter crisis. And what makes it so difficult is that overcrowding is primarily caused by unethical breeding. Honestly, all breeding. But unethical breeding, or what you may have heard as backyard breeding, is a huge contributor. Because as of today, it's already so hard to find any kind of data on licensed breeding and the output of licensed breeding. It doesn't include anything that's being output back into the communities by individuals that are not licensed and not following the proper procedures and having no accountability for the animals that are being let out into the community. The problem is that breeders are producing so many animals that go to the community in an instant, as a surprise, as a gift. Who knows for what reason that families are buying and purchasing animals from breeders. And what ends up happening is that these families end up finding that they can't take care of an animal long term, or perhaps it's not what they were expecting out of an animal. And so those animals, unfortunately, end up abandoned either in the streets or taken directly to the shelters. In other cases where the breeders cannot sell the animals that they've bred, they themselves will abandon them in the streets or take them to the shelters. Taking a look at some of the data that's available, and in this case, we looked at a company that does web scraping to find actual data from the USDA and other entities that have tracking of these licensed breeders. We were able to find, at least for now, preliminarily, because like I said, this data is very hard to find, that there are approximately 1,004 licensed breeders in California. And again, I want to highlight that these are just the ones that are licensed, meaning that we have account of them. There's plenty of other unlicensed breeders that are doing the same thing that we have no account for. The problem is, of these 1,004 licensed breeders, if we just do some basic math, what we calculated, or rather through our research, we found that on average, a dog litter will contain anywhere from 5 to 12 puppies. The average number is 5. So if we start with even just the smallest number, 5 puppies per litter, the quote unquote responsible number of litters that can be produced, and this is just guidelines provided by other entities online, we may expect to see anywhere from 5 to 6 litters per year from one dog. The problem is that most of these licensed breeders have about 6 to 8 dogs. So when we multiply all of these numbers, what we end up seeing is that for about 8 dogs producing 5 puppies per litter over the course of a year, for all 1,004 breeders, we're looking at an average of about 125,000 dogs only, not including cat breeders, not including small animals or birds, but just dogs. 125,000 dogs put out into the community without any promise of having a home, just breeding. When we take a look at the data around shelters and how many animals are euthanized in the shelters for space, California and Texas are 2 of the highest kill rates in the entire country. If we were to look at just California alone, California as of 2022, and this is based on data published by bestfriends.org. And again, this data is not easy to come by, but when you do find it, these are the general numbers that we're seeing. California killed 51,361 animals as of 2022 that entered the shelter. That's about 20% of all of the animals that entered the shelter in 2022. So if we compare that 51,000 to the 125,000 animals that are produced at minimum just by licensed breeders, not including how many animals are being bred by unlicensed breeders also entering into that calculation, it's no wonder that the shelters are overcrowded beyond capacity. There's too many animals going into shelters. There's not enough people adopting and rescuing from shelters, and there are far too many individuals abandoning their animals in the streets who ultimately end up at the shelters. So in order to address any of the issues that we're actually seeing inside of the shelter, we have to get this overcrowding issue under control. And so when we talk about impacting the shelter inside, what do we mean? We're talking about something that is called standards for quality of care. My background is in human healthcare. I've been developing solutions for the healthcare system, following regulations and guidelines set by like the state and entities regarding human healthcare. Across all of these entities in the industry, the same requirements exist for standards of quality of care, which basically guides how you're supposed to treat patients, how you're supposed to treat facilities, what kind of minimum requirements exist to make an environment safe for a living being. In this case, there are standards for quality of care for animal shelters. And this set of guidelines has been published by the American Associations of Shelter Veterinarians. And they established these guidelines specifically to try and offer direction to animal shelters all over the country on how to handle capacity, how to staff for capacity, how to implement emergency triage and medical triage, and how to clean the kennels in the shelter in a way that's safe for visitors and for the other animals. All of these guidelines exist. They're out there. The problem is that the policies and procedures inside of the shelters are so old. Some of them that we've requested from various shelters in the state, we've seen have not been updated since the 90s or the early 2000s. So clearly those policies and procedures are completely out of date. When you look at any other industry, it's a requirement that annual policy reviews are conducted to make sure that the policies in place for these companies are still up to code with current business environments. We should be seeing that inside of our municipal facilities. An animal shelter that has not updated policies in over a couple of decades needs to have a review of those policies and see, hey, how do they stand up to our current environment? Does this address all of the issues in our current environment? And through a series of our analyses in different areas, it does not. It does not cover it, all of the issues that we're seeing. But the problem is, how do we bring these issues to the attention of the correct people that can take action and implement these standards? And that's where this conversation is heading. How do we as a community get these concerns in front of the right people and ask for the right things to see these changes happen inside of shelters all over the state? And we're going to talk about in a little bit the differences in the layers of government and how to reach out to shelters, how to reach out to your local shelter and ask for these changes. But let's go over a couple more of these issues first to understand the big picture. When we talk about standards of quality of care, some specific examples. One thing that we see a lot is in shelters, you have animals that clearly have visible injuries or illnesses that are not receiving emergency care or medical care. And if you take a look at any policy across any shelter, they're all very clear. When an animal comes into a shelter for the first time, it goes through a process that's called intake. That intake process means that someone from the staff physically accepts the animal, does an evaluation of the animal, talks to the animal control officer that brought them in or the individual that brought the dog in to understand its history. Were there any bites? Were there any injuries? Are there any signs of illnesses? All of these things take place before the animal is even entered into the system, which means that the shelter already has access to a good amount of information. Now, from this initial evaluation, again, this is per shelter policies and through California statutes that indicates the shelters are supposed to do a medical examination on that intake to see if there's anything happening with the animal that needs to be addressed by a veterinarian before they actually go into a kennel at the shelter. So what happens when we have animals that have broken bones or chronic illnesses?
What about behavior? Are they supposed to be analyzed on that?
Yes, absolutely. That's a good point. Behavior is another big component of that evaluation. What's challenging is that the behavioral component and the medical component is slightly different. And because of that, it can be complex in addressing them, which is why we're going to talk about it in a few minutes, why we separate out the behavioral assessment, because there's so many more other opportunities for errors to happen on that behavioral assessment. But even starting with the medical assessment, just to make sure that these animals don't have, like I said, broken bones or contagious illnesses at intake is so important. Something that we talk about in human healthcare all of the time is the importance of prevention over reaction. You don't want to have an outbreak of something contagious or dangerous that a hospital or medical facility has to try to get under control, because that in and of itself is more expensive. It costs more resources. It's more challenging for the facility to get that under control. And over everything else, it's more dangerous to patients, to staff, to visitors, to everyone. So the model is to avoid reacting to these outbreaks, to have stricter standards on preventing illnesses, preventing all of these issues that could grow into something that spreads a lot faster than staff can control it. And so this idea of prevention over reaction is important because it all starts at the intake and doing these medical examinations, triaging their medical care based on how severe their illnesses present. Now, a big issue that we talked about is the behavioral assessment. There's two main issues with this component in the shelters. On one end, there's an issue with behavioral assessment not being done at all. On the other hand, there's an issue with behavioral assessment being done incorrectly. And we're going to talk about the issues that come with both. When it comes to doing a behavioral assessment, the idea is we're trying to find out if the animal has some kind of behavioral issue that might make it preventable from adopting. And that's just per the legislation. That's just per what is stated in policies and in the written guidelines. When the state looks at an animal's behavioral issues, they're checking to see if an animal is a danger to society. Will they accidentally hurt someone out in the community if they get adopted out? So the criteria that the shelter is looking for is this animal going to be dangerous if it leaves the shelter? That's what the assessment is for. That being said, if an assessment is not done as they come into the shelter, number one, what we're missing is an opportunity to learn if the animal has some type of post-traumatic stress disorder or a fear-based reactivity to some abusive environment that it's coming from. And this is important because if you just imagine an animal that's coming from an abusive household or is being confiscated by the police and is taken to an animal shelter, because it's a very common way that animals are brought into the shelter, what that usually means is they've been exposed to some kind of physical or emotional trauma that has changed the way that they react to the world around them, just like with any other living being. And so if this happens, a behavioral assessment will help the shelter understand, okay, you're coming from an abusive environment, maybe approaching the kennel with a catch pole and very aggressively and putting you in a kennel with 3-4 other animals is not a good idea. Maybe what we should do is isolate the animal, help decompress, maybe increase the amount of enrichment and time it gets out of the kennel, more social interactivity with the kennel officers, so that way they begin to come down from constantly being in defense mode. That is a way that we can do a behavioral assessment and come up with a plan for an animal after that behavioral assessment, so that way we can still try and work to find a positive outcome. That doesn't mean that from first meeting the animal, you see some growling or signs of fear, that we're going to say this animal is absolutely a lost cause and behavioral issues are too drastic, they have to be euthanized. It's a huge miss if we don't do that behavioral assessment. Now, on the other hand, if the behavioral assessment that's done is not done correctly, or it's done by someone that's not necessarily trained in animal behavior, and while there are animal behaviorists that are hired at some animal shelters, they're not available at all animal shelters. Does that mean that nobody at the animal shelter can do a behavioral assessment? That's not necessarily the case. But what we would expect is that whoever's going to be doing those assessments has a clear outline and understands the guidelines on what it is that you're looking for and what kind of body language should you be looking out for. What does that body language mean, and how do you come up with a plan to address the behavioral issues that the animal might have? If you take a look at the legislation, it's very clear that euthanasia is only supposed to be used if an animal is irremediably suffering or if they have behavioral issues and enough of an effort has been made by the shelter to make the dog quote unquote adoptable. And forgive me, not just dog, but any animal, as long as they're adoptable. So making an effort translates into coming up with a plan, coming up with an enrichment plan, giving them more exercise and socializing them to give them a chance. If we, from the assessment, decide that this animal is dangerous, we're not going to give it more enrichment because it's dangerous. We're not going to give it walks because it's dangerous. We're not going to introduce it to other animals or to other people because it's too dangerous. All we're doing is exacerbating the issues that animal is already feeling. We're increasing the level of stress. We're decreasing the amount of positive tasks that can be done to help that animal exit that feeling of fear and aggression. And we're actually putting it in a confirmed area that, yes, this animal is not going to be safe for society. And the worst part is that's not the animal's fault. And so these behavioral assessments are critically important, but it's critically important that they're done correctly. And again, this is where those standard guidelines come into play. And we're going to talk about how those standard guidelines might have an impact on this whole issue in a little bit. So part of what we talked about is inappropriate euthanasia, and this conversation can go on probably for its own episode in what types of improper euthanasia we see. But the two biggest issues is, number one, animals that are labeled as behavioral or aggressive inappropriately, and because of that they're euthanized, or in cases where capacity is at its maximum and the shelters will begin euthanizing for space. In either case, the public doesn't have necessarily any control or ability to change what animals get euthanized and what animals do not. But part of what we as a community are trying to ask of the shelters and the animal control system is, can we have a better system of deciding who will be euthanized and for what reasons? So that way animals that do have a chance of becoming adoptable, for example, an animal that comes in that's maybe no more than 3 months old. I'll give you an example. This happened at a local animal shelter that we visit and we started our work at. And we met 3 puppy dogs, huskies. They were no more than 3 months old. And a kennel attendant, while cleaning their kennel, was bitten by one of them. And after being bitten by one of them, and keep in mind, these puppies were teething. They were no more than 3 months old, so it wasn't a bite. They were nibbling because they're teething, as do all animals. The kennel attendant could not remember which dog bit them, and because of that, euthanized all 3 of the puppies. This is a case of an incorrect behavioral assessment and an inappropriate use of euthanasia on all 3 animals. There obviously was not an effort made to try to make those dogs quote unquote adoptable. There clearly was not a medical assessment done that would have confirmed they're just teething, they're not biting. And at the end of it, 3 animals were euthanized prematurely over maybe an other animal that has been there for an inhumane amount of time, or that is irremediably suffering and instead is being left in the shelter to suffer without medical attention, which is a whole other issue, an inappropriate or an inadequate amount of medical care. Another example that we saw that combines both the medical care and the behavioral assessment is with a pregnant mom that we helped exit the shelter. We found that this dog had been labeled as aggressive and scheduled for euthanasia. And on the day that she was scheduled for euthanasia, we helped find a rescue and helped her find exit. What ended up happening was that the kennel attendant that went to visit this dog found that she was growling and giving him some aggression. And because of that, she was labeled as aggressive with behavioral issues. After she exited the shelter and saw a vet through the adopter, we found out that she had already suffered from a broken pelvis and was pregnant with a litter of puppies, which means that the growling in her kennel was probably a combination of natural defense for her unborn litter and the severe amount of pain she was probably in from having a broken pelvis, sleeping on a cement floor with a litter in her stomach. And so instead of seeing this as aggression and marking them for euthanasia, instead a different plan could have been to get her medical care, to find out that there was a broken pelvis, to try to treat that pain, and to maybe make that dog more comfortable to help her get through her labor easier. In this case, the broken pelvis was not disclosed to the rescue nor the adopter, so all of the financial weight of finding out about that issue and helping her through that issue falls on the adopter. And while this doesn't seem like a huge deal, at the end of the day, we have to remember that these municipal facilities are funded by the public. These are tax-paid facilities, meaning that all of the money that we're paying as a community for these facilities to run up to a certain standard and to provide a certain level of care to the animals that we as a community very much care about, we're expecting them to receive at least a basic minimum level of care. And something like spotting a broken bone and treating that and not marking that animal for euthanasia along with the unborn puppies because of that pain that they're in is part of what we considered an inefficient process, a deficiency in the policies of the shelter, and a violation of state penal codes. And this is a good segue to talk about now, how do we as a community try to help this issue? How do we tackle these issues? because clearly they're very complex. So who do we call? Who do we reach out to? Who do we ask for help? This is the part that gets complicated. And to try and understand it, we have to break down both the layers of government involved and the types of shelters. In understanding the layers of government, we'll just kind of talk about what layers are involved in this process, but we'll save the breakdown of the layers of government for another episode. And to that point, if you have questions about that, specific questions that you'd like to hear about, please leave them in the comments below, or you can send them to us in an email, which we'll include in the description. And that way we can talk about it on that episode dedicated to the layers of government. But for now, let's focus on how do we report these issues then? If you go to the shelter, or you know someone that's been to the shelter, or you have witnessed or experienced some of these issues that we're talking about, how do you go about reporting it? Who do you tell? And how do we try and address these issues? There are 3 types of shelters in our community that we should all be familiar with. We're only going to talk about 2 on today's episode. So today we're just going to focus on the municipal facilities, which are the county-run shelters and the city-run shelters. County shelters are run basically by a board of county supervisors. The board of county supervisors appoints people to run multiple departments for an entire county. And a county is broken up into multiple districts, right? So if you think about one county, let's say San Bernardino County has multiple shelters in it, and those various shelters all service different areas of the county. Those different areas of the county are called districts. Each district has its own supervisor. All of the supervisors across the county report to a board of supervisors for the county. That board of supervisors will appoint staff to the public health department that is responsible for the animal services program. The name of the departments and maybe the titles of who's running the department may vary a little bit, but overall you can follow this same guideline. From the animal services department, there's going to be a chief of animal services and or a program manager. These are the individuals that are responsible for the policies and procedures that operate the shelters. The shelters themselves, with the staff that run the shelters, I want to be clear, are not the individuals that can change the policies. If you're having issues and you're trying to contact individuals at the front desk or people that you see out at the kennels, they are not going to be able to help you. They're not going to be able to change any policies, and they're not going to be able to take it to the people that can. Which means that it's up to us as a community to make sure that we're communicating this to the right individuals through the right chain of command. First and foremost, it's important that you notify the shelter supervisors, because that notification is going to show that you, as part of the community, took the steps you were supposed to try and address the problem the way that you were supposed to. Because the next step is then going to the county for more intervention if you don't get that cooperation from the shelter supervisors. If you have to go up a level after the shelter supervisors, whoever it is, whether it's the animal services department or the public health department, maybe you want to go directly to the board of supervisors. In all of those cases, there's something very important that you need to have prepared. And this is the same for the city shelters. And ultimately, when we start talking about legislation and requesting our state representatives to make changes, this step is so important. You must identify the actual violations of a shelter policy, procedure, or legislation, whether it's at the state level or the federal level. Once you have found that violation, you can now describe, this is what I saw. This is the violation, or what I saw was a violation of this statute, of this policy. You're showing concrete evidence of an incident that's violating the policies or the legislation that's supposed to be governing that facility. That's what these individuals care about. That's what they need to know about. So starting with identifying what the deficiency was and how that compares to your example is step 1. What if it's not a violation of legislation or a policy, but it's putting the animal at risk, it's putting their life at risk, or it's creating a danger to human visitors around them? I'll give you an example of this. The sanitation protocol in shelters is a huge problem. Animals have a totally different digestive systems than humans do, which means they carry bacteria in their gut that they can process without a problem. It helps them process their food without a problem. But to humans, it could be potentially fatal. What ends up happening is that if these animals, and try to picture an animal shelter where you have multiple kennels all butt up next to each other inside either a closed facility or an outdoor facility, but all butt up next to each other. When the animals defecate or urinate on the floor, the bacteria from their gut is obviously exposed to the outside. What should happen is that a kennel officer, someone from the shelter, would pick up that feces or the urine by hand first before scrubbing the area clean to prevent the spread of that bacteria. What ends up happening because of time, and what we've heard is because of overcrowding and how difficult it is to make this process different, what ends up happening is that the shelter will use hoses to spray that feces and urine off of the floor, either into the drains or, quite frankly, out into the aisles of the shelter where they can then drain it. What's happening in this moment is that you're taking all of the bacteria and the contagion in the feces and the urine and spreading it at an exponential rate to anybody that's walking by, anybody that's working there, and even worse, to all of the other animals in the neighboring kennels. That's a problem because now if one animal has something that's potentially contagious, it can not only spread, but it can now start a chain reaction of an uncontrollable illness breaking out in the shelter. For example, distemper, which many individuals in the rescue community are familiar with, unfortunately. These kinds of issues can be prevented by simply changing the sanitation protocol. But changing that sanitation protocol can't happen without showing the governing boards the reason for the change being required. And so that all starts with, like I mentioned, what if it's not a violation of law? It's not a violation of legislation. Clearly, it's posing a risk to the health of the human visitors and the staff, and it's creating an even bigger risk for the animals, which at the end of the day, even though depending on what side you're on, the financial part of it is not as important as the animals, but to the governing boards and the entities running these facilities, the financial piece is critically important. They have to know the impact of the process in order to make a change to that process. So step one is identifying the deficiency. How is what you witnessed a violation of that deficiency? And if it's not a hard violation, how is it creating a risk? That's step one. So now that we understand the county shelter structure and that first important step, it's time to talk about the city structure. Once we understand both the county and city structure, we can talk about the second step because it's always going to be the same. So in the county shelter, as we mentioned, you have your board of supervisors who have a supervisor in each district who is responsible for the shelter. And then the shelters will have an animal services program with either a chief of animal services or a program manager. And then you're going to have the shelter staff, including the shelter supervisors. Keeping that same structure in mind, let's think about the city shelters now. The city shelter will start with the supervisors and staff at the shelter. And from that point, the next level will be a city-appointed animal commission and or general manager. This part is important and complicated because it could be different for every city. And that's where the city shelter structure is a different process than the county structure in who do you reach out to. It starts with identifying who these people are in your city. So if there's an animal commission, you would want to find out who's on that animal commission. If there's not an animal commission, you would want to find out who's been appointed to run the animal services program. After the general manager and the animal commission, the next level would be the office of the mayor. And so you can see that this line going from the shelter to the mayor is a lot shorter than in the county, where it goes from the shelter up to the county board of supervisors. In a county structure, there are more levels of the chain of command that you can reach out to if one level is not cooperating. On the city side, it's a little bit more complicated because each city is appointing individuals to run the program. But in either case, there's going to be some kind of animal services program, and that program is responsible for the policies and procedures in place. This is all important because, talking about step 2, we want to make sure we're reaching out to the correct individuals once we've identified what those deficiencies are. So you see something in the shelter, step number 1, document it. Write it down, take a picture, write it in your notes, keep it documented with the deficiency you identified and how that applies to what you witnessed. The next step is communicating that to the right individuals. And you're going to potentially reach out to all of the individuals in this chain of command, but it's important that you follow the right order and that you save that communication through each level. A lot of individuals feel like this can be tedious and unnecessary, but when we have sat in the room with legislators, with government officials, with these chiefs of animal services programs, everybody asks for the same exact things. What steps did you take? Did you take the steps that are required by our city or our county? And where is the data to support what you're asking for? These are the most important questions that we are asked. It is the most important information that you need to provide. So keep track of all the communication you do to that shelter supervisor, to the GM or to the animal services program after them, to the county supervisor after them. You want to keep track of all of this documentation. Because if everyone at every layer is either not responsive or not cooperative, there are still steps that we can take at the next layer of government. And we're going to talk about the layers of government in another episode in much more detail because it is very complex. And there's a lot of, if this happens, then you want to do this. If that happens, then you want to do this. So we're going to talk about it in more detail. But for now, it's important that we as a community start getting organized with what we're seeing, the efforts that we're making, because then later, if we have to take that next step, everyone will have saved what we need to have those conversations. What I'd like to close with is how important it's going to be for us all as a community to stay organized, to collaborate, and to share as much information as we can with each other. Over time, we're going to see this conversation change in a lot of different ways. And there's going to be different groups working at this problem on many different levels. We're going to have individuals working at the shelters trying to network and save dogs, trying to work with the staff. We're going to have groups that are working on legislation and working behind the scenes. It's important that everyone tries to share as much information as we can with each other on this crisis, so that way we can be well equipped for whatever comes after saving everything. And with that, I just want to say thank you for joining us for the first episode. I am absolutely looking forward to doing more episodes, and I'll see you in the next one. Thank you.